Hello everyone, welcome to my class today. Today we'll see the continuation of health assessment, that is in physical examination head to toe assessment. So in previous class we have just saw some introduction about the steps in physical examination like inspection, palpation, percussion, auscultation and olfaction. So today we'll see the head to toe assessment theoretical part. So head to toe assessment is a comprehensive health assessment we do on the patient from head to toe whenever we first meet the client. Okay, whenever we are in contact with the client, we will do this procedure in order to see if there is any changes in the body and also if the patient is hemodynamically stable. Okay, hemodynamically is nothing but the temperature, pulse, respiration and the blood pressure. So whether these are stable in the patient's body, to identify that we do a head to toe assessment. And whenever we are doing the assessment from head to toe, if there is some specific findings, okay, if there is some unusual findings, then in that organ system we have to do a detailed assessment of the organ system. For example, if the patient is having some problem with breathing, then we have to detailedly check the respiratory assessment. So this system wise assessment will be dealt in the further classes. So today we'll see the preliminary steps, that is before doing the procedure we have to follow certain rules or regulations before starting the physical examination. So that is perform hand hygiene. So you have to wash the hands and you have to check the room for contact precautions. Okay, in case patient is an infected patient, then we have to use contact precautions like gloves or mask or any gown. So you have to check all those precautions. And then you have to introduce the client. So client and you should maintain a relationship, or we have to have a good communication and IPR with the patient so that patient will accept to do the procedure. So you have to introduce yourself to the client and also you have to confirm the patient's ID. So whenever we are confirming patient's ID, we have to use more than one method of checking the ID, like patient's name may be similar with other patients. So you have to see if there is any unique ID number or with date of birth, etc. We have to confirm the patient's ID so that we will know whether we are checking for the correct patient. And you have to explain the procedure to the patient. So you have to tell what procedure you are doing and the need for exposing the body parts. So everything you have to tell so that patient will gain confidence and he may also accept for doing the procedure. And then whenever we are doing assessment, we have to follow an organized, that is systematic way, step by step method we have to follow. Haphazardly we should not do the procedure. Okay, like from head to move on to the chest, abdomen and then the neck, leg. Okay, so like that we have to follow some systematic way. And you must have good listening and questioning skills. Okay, so when patient is telling something, we have to be able to listen to the patient so that we can get some idea of what the patient is having problem. And if we find something abnormal in the patient's body, then immediately we have to have the skill of asking questions so that we can identify why those unusual changes takes place in the person. Okay, and also because in physical examination we need to remove the body, that is we have to remove the patient's dress. So we have to maintain privacy so that we will respect the dignity of the client. Okay, so next we have to check for the ABCs, that is airway, breathing, circulation, consciousness and safety. Like if patient is needed any suction, oxygen. So if the patient is having some breathing difficulty or something, first we have to attend to that, then only we have to do a physical examination. Okay, so before doing physical examination you have to see whether the patient is stable, that is airway, breathing, circulation, everything is stable. And then you have to follow the principles of asepsis and safety. Asepsis is we have to prevent microorganisms, so we have to see that the room is disinfected properly, and also we follow all the universal precautions while doing the procedure. Okay, and next the assessment techniques, that is head to toe assessment. First we do a general appearance. So you have to check for the mood, behavior, anxiety and how the patient is hygiene or not. And we have to see the client's posture. Okay, some patient who are alcoholic and other, they don't maintain body posture. So you have to see his posture so that we can identify certain things. And gait and mobility. Okay, so whether patient is able to move straight or is able to stand straight. Okay, like in old age they will have a bent gait. Okay, so that all you have to check. and for speech pattern and articulation. So you have to talk with the patient and see how the patient is speaking. Some patient will not have some articulation, okay, that is they may say, like if they want to say assessment, they may assessment, okay, so like that they may have problems with articulation. So these all you have to check before taking an head to foot assessment, okay. Then in the skin you have to check for color, appearance, dryness, lesions, rashes, bruises, and for any redness. So mainly on the pressure points like heels, ankles, elbows, buttocks, hips. So these are their pressure points. So you have to see whether there is redness or excoriations in those area. And skin turgor for moisture and sorry, you have to check the skin for turgor, okay. So like in case of dryness, the patient will have poor turgor, so you have to check for that, and moisture and temperature of the skin, and for any edema of the body, okay. So edema can be locally in a particular area, or some patients with kidney disorders or heart failure, they may have a generalized edema, that is called anasarca. So these all you have to check. And for the hair and scalp, you have to check for lesions, any excoriations, scratches, like when patient is having lice infestation, they may scratch and get bleeding from the scalp, okay. So that all you have to check. And for dandruff, lice, so dandruff, lice and nits or small one of lice, this you have to check. And hair color, texture and thickness you have to check. And for the nails, you have to check for color, consistency and capillary refill, okay. Capillary refill is when you press the nail buds, nails will become white in color. When you release it, immediately within 3 minutes the nail beds should be red in color, okay. And next in the head, you will see for the size, shape of the head, okay. Sometimes in hydrocephalus the head may be bigger in size, so that all you have to see, and the shape of the head, okay. And sometimes patient with congenital deformities, they have a different shape in the head. And size and shape of fontanelles in the infants, okay. So infants have two fontanelles, like anterior and posterior fontanelle. So that is a depression will be in this area. So you have to see that whether the depressions are full or it is more depressed, okay. So in case of hydrocephalus, the fontanelles will be bulging, and in case of malnutrition or nutritional deficiency, the fontanelles will be depressed more, okay. So that you have to identify. And inspect the symmetry of face, okay. Like in cerebral palsy, the face will be deviated to one side, so those symmetry you have to check. And for pain, tenderness, injury or facial puffiness, so this all you have to palpate and see. And also palpate for the temporal and the frontal pulses. Okay, in the eyes you have to inspect for the presence of eyebrows and lashes. So some person would have removed the eyebrows and eyelashes, so this all you have to check. And also for any discharges and color for the eyeball and sclera, okay. So in case of conjunctivitis, patient may have discharges from the eye, and also the conjunctiva will be red in color. And in case of jaundice, the sclera will be yellow in color. So these changes you have to inspect. And also you have to inspect the lens for transparency or opacity, okay. In cataract, patient will have a opaque lens. And also palpate the eye for any tenderness, and also you have to check for the reflexes in the eye, okay. And also you have to check the pupillary reaction to the light, okay. So you have to keep the torchlight and see whether the pupils are reacting to the light. Pupils usually they have to constrict for the light, okay. So some patients with lack consciousness or in coma, they have dilated pupils, that you have to check. And for visual acuity, you have to use a Snellen chart, or with your fingers you can show 2 and 3 and ask the patient to tell the correct numbers, okay. So like this you can check for the eyes. Next is ears. So again in ear shape, size, symmetry. So some patients will have different shapes and size may be small in case of congenital deformity, and symmetry, some will have changes in the symmetry. So this also like in conditions like Down syndrome, so the symmetry of the ear will change, okay. So you have to check. And for cerumen impaction also you can identify. So this can be done with the help of an otoscope. And also you have to see whether patient is having any hearing aids or cochlear implants is kept. And you can check for drainage or bleeding or periauricular ecchymosis, okay. Ecchymosis is bluish discoloration around the ears that you can check. And for hearing acuity, so there are two tests, Weber's test and Rinne's test are there. So with the help of a tuning fork you can see the Weber's and Rinne's test, and also palpate the ear for any pain or tenderness. And next, in the nose, you have to see for the shape, size, symmetry of the nose. So again, in case of septal deviation or in case of nasal deviation, their symmetry may change, and also congenital defect, there can be change in the shape and size. Okay, and in case patient is having respiratory problems, there will be flaring of nose, that is the nasals will be flaring and they will be full. And nasal cavity, you have to check for septal deviation, so that is in between the two nerves there is a bone called nasal bone is there, so that nasal cartilage can deviate to one side, that is called septal deviation. So these you have to check, and you have to see if the patient is having rhinorrhea, that is in case of cold patient may have discharges from the nose, and nasal congestion where the nasal nose will be red in color and bleeding. So this all you have to identify. And then palpate the sinuses. Okay, so near the nose there are sinuses, so you have to palpate the and see if the patient is having tenderness. And for sense of smell, you can ask the patient to close the eyes, and you can give some powder or something for the patient to smell. If the patient is able to smell it correctly, then the smell is good. Okay, in mouth you have to see for the size, symmetry and angular deviation. So in case of facial paralysis, the mouth will be deviated to one side, that you can check. And in the teeth you have to check for the color. So color can change in case of decayed teeth, or if the patient is not having the habit of brushing properly, so you have to see cleanliness. Dentures are artificial teeth, so in old age patient may don't have teeth, so you have to check for the dentures. And how many teeth present, you have to check. In case of children, you have to check the number of teeth. And also you have to see if there is any halitosis, that is bad odor from the mouth, and any infections like dental caries. Okay, so there will be tooth decay where there will be black color teeth. Okay, so that is dental decay. And you have to check for stomatitis, that is inflammation of the gums. Periodontitis is inflammation of the teeth and the surrounding structures. And peritonsillar abscess is abscess in the mouth and the teeth, so that you have to identify. Abscess means pus collection. And in the tongue you have to check for the color. So sometimes in anemia patient tongue will be pale, or in patients with GI disease there can be beefy red tongue, so we have to check the color of the tongue. And movement. Okay, so ask the patient to move the tongue here and there on all the sides. So in case of any motor neuron problem, the patient may have problems with tongue movement. And infections like glossitis, that is inflamed tongue, can be checked. And also you can check the sense of taste by placing a sugar or salt in the tongue and ask the patient to tell the taste with keeping their eyes closed. And for the lips also you have to inspect for the color. Again, lips may be pale in color if patient is having anemia, and there will be dryness in case of fever.
Check for deformities like cleft lip and cleft palate.
And cracked lips when patient is taking some medications or he is having poor nutrition. And there can be lesions, so that is injury from the lips, or infections like chelosis. Okay, so chelosis is inflammation of the lips, and there can be, so this inflammation of lips is called it can be due to vitamin B2, that is riboflavin deficiency. So this all you have to check in the mouth. And next is in neck and throat, you will be inspect for the shape, size of the neck, and also use of sternocleidomastoid muscles. Okay, when patient is having a hard breathing or labored breathing, you can see the neck muscles are also moving for breathing, that is called use of sternocleidomastoid muscles for breathing. And there will be tracheal shift. So for tracheal shift you will be using 3 fingers. So one finger you will be keeping on the tracheal line, that is the middle finger. On either side 2 fingers you have to keep, and you have to slide the finger down. So if there is a tracheal shift, you can see the finger sliding to one side. Okay, that you can identify. And also jugular venous distension, so that with when you ask the patient to turn to one side, you can see the distended veins. And there will be enlarged thyroid gland, so you have to tell the patient to swallow. and if you can see visibly the thyroid gland is moving up and down, then we can think that the thyroid gland may be enlarged. And also you have to check, palpate for the carotid pulses. Okay, so carotid pulses should be present, and whenever you are checking carotid pulses, you have to check each side, that is right and left carotid pulses will be checked separately. Okay, in throat, using torchlight or a laryngoscope, you can check for the color or any infected tonsils or any coated area in the throat, or also you can see the ability of the patient to swallow and speak. Okay, so because larynx box is in the throat, so you have to ask the patient to speak and also ask the patient to swallow and identify for any changes. Okay, and next coming to the chest. So in chest you should identify the problems with the respiration and also problems with the heart. So in respiratory problems you will inspect for the shape, size, symmetry, and also AP diameter, AP to lateral diameter of the chest. Okay, so usually AP diameter should be lesser than the lateral diameter, that is 1:2. So you have some patients who have COPD, they will have a barrel chest, so that time both AP and lateral diameter ratio will be equal. Okay, and other pigeon chest, so many types of deviations are there that you can identify. And also you have to see the chest wall movement, whether the air entry is clear or not. Okay, so both the sides, whether the chest wall is moving simultaneously or symmetrically when the patient is breathing, that you have to check. And for thoracic so you have to check for the thoracic retraction, that is both chest are moving, and use of accessory muscles for breathing. Okay, sometimes patients who have shortness of breath, they may use diaphragmatic muscles. All muscles will be used more for breathing, so that you have to check. And for and if patient is having shortness of breath, and also you have to check the respiratory rate while inspecting the chest. And also on the thoracic borders, that is on the thoracic wall, you have to percuss and see for the sounds. Okay, resonance is a normal lung sound. So in case of some emphysema or air filled lungs, there can be hyperresonance, or when we are percussing the lungs, when we go down to the liver or on the muscles, there can be dull, and on the rib cage it can be flat sounds. Okay, so these sounds you can hear. And you have to auscultate for the respiratory sounds. So normally there will be bronchial, vesicular and bronchovesicular sounds, and if patient is having any adventitious sounds, then it is abnormal. In heart, you have to inspect for visible heaves. Visible heaves is nothing but you can see the chest wall movement on the chest. Okay, that is the pulsation you can see on the chest when patient is having some problems with heart, like congestive heart failure or any infarction. You can see the visible heaves, that you have to check. And also see for the shape and size of the chest. So sometimes in cardiac megaly, you can see the heart size will be increased. And also palpate on the heart borders, yeah, and see for any masses, tenderness or any apic. And also you have to palpate for the apical pulse. Okay, so apical pulse is at the 5th and 6th intercostal space, midline, in the mid clavicular line. When you feel for the pulse, you can hear the apical pulses. And then you have to auscultate for the S1 and S2 sounds. Okay, so there are aortic area, pulmonic area and mitral area. So in that is tricuspid area. So in this area you have to check for the S1, S2 sound. So normally it should be heard, and some patient may also have abnormal murmurs. Okay, so these all you have to identify in the chest. Next, coming to abdomen, so you have to inspect the shapes. So some patients will have scaphoid. Scaphoid is when the patient's abdomen is going inside. Okay, so that is due to nutritional deficiency or lean body mass. Patient's abdomen will go inside, that is called scaphoid. And some will have round, so that is during pregnancy or something, due to the fetus there will be round shape, or some will be oval, or a pendulous. Pendulous is when there is more of fat, okay, adipose tissue, when the muscles become more thick in the abdomen, there can be pendulous abdomen. So this shape you have to see, and size and symmetry. So both the sides, whether the abdomen is full or 1 side it is full. Okay, so this symmetry you have to see, and color, texture, distension. So in case of any peritoneal fluid increase, there will be distended abdomen, or in the fullness in the sides. Okay, so flank region, sometimes there may be fullness. So all those things you have to identify and auscultate the abdomen for any for the ball sounds. Okay, every time in abdomen, first you will do, after inspection you have to go to auscultation, because once you palpate you can dislodge the organs. So at that time ball sounds cannot be auscultated correctly. So after inspection we have to do auscultation. Okay, so note for ball sounds, and then go for palpation. So in palpation again there is superficial, deep palpation. So with this you can see for pain, tenderness, masses, any nodes or any organomegaly like hepatomegaly, splenomegaly, that all you can identify. So abdomen has quadrants. So all the quadrants of the abdomen you have to check, and also presence for fluid thrill you can percuss. Okay, and also you can percuss for dull, flat or tympani sounds. Okay, so these are you have to check in the abdomen. And next, coming to extremities. So again in extremities, both upper and lower extremities you have to check. So here you will be inspecting for shape, deformity, size, symmetry, color, etc., and also presence of edema. Okay, so usually in case of renal diseases, patient may have edema. So if there is edema, again you have to check for pitting and non-pitting edema. All you have to check, and also you have to check for the pressure points. Okay, like heels, knees, elbows. So these are all pressure points. So in that you have to see if the patient is having any bruises or any sores. And also the skin of the extremity should be observed for dryness or integrity. Okay, so integrity is sometimes patient will have wrinkles, or sometimes patient will have a flabby muscles without lack of nutrition. There won't be thick muscles. Okay, this all you have to assess. And also you have to tell the patient to move all the joints, so that you can see the range of motion is good or not in both extremities. And also you have to palpate for brachial, radial, ulnar pulsation on the upper extremity, and in lower extremity you will be palpating for femoral, popliteal, tibial and pedial pulsation. Okay, so whenever you are palpating these pulses, you have to palpate on both the sides simultaneously, so that you can see the rate, rhythm and quality of the pulses in both the sides. Okay, so both the hands. Okay, both the hands and both the extremities. And also you have to palpate and see the warmth and also sensation. Okay, so we have to keep the warm or cold water on the patient's body and ask if the water is warm or cold, so that we can see patient is having sensation of touch or not. And then you have to palpate for hand grip. So give shake hand or something, and tell the patient to hold your hand tightly. If the patient is able to hold it, then the grip is good. And strength of the muscles, so that is we have to tell the patient to move the body part against the resistant. Okay, like you have to touch the leg and give resistance, but patient has to move against the resistance. That is called that is so that is the muscle strength of the muscles. You have to check by that way. And also you have to inspect the fingers. So that is if there is any polydactyly. Polydactyl is some persons will have extra fingers like 6 fingers or 7 fingers, so that you have to check on the extremities. And syndactyly, some person may have fused fingers. Okay, so 1 or 2 fingers will be fused, so that you have to see. And if there is any amputation, amputation is cutting or removal of a body, that is a limb or a finger. So all those things you have to check in the extremities. Okay, next coming to genitalia and rectum. So again in genitalia we will be checking for discharges, any ulcers, redness, or if patient is having catheter. Okay, some patient may have come with catheter if they have some problem with the urinary that is urination. Okay, and also in case of women, if she is in a postnatal period, she may have sutures, or in a post surgical there may be sutures. So that all you have to assess for the sutures, whether they are healthy, etc. And then you have to check for the cleanliness or any smell or any excoriation. Excoriation is infections in the genitalia. So usually sexually transmitted diseases, person will have severe excoriations in the genital area. And in case of males, you have to also palpate the prostate to see if the prostate is enlarged. and also see the scrotum, penis for any discharges or excoriations in males. And in rectum you will be checking for any hemorrhoids. Okay, so when patient is having severe constipation, sometimes the blood vessels can come outside, that is called piles, so that can be internal or external hemorrhoids, so you have to inspect for that. And also fistula. Okay, so fistula is abnormal connection between two organs. Okay, so in genitalia between rectum or vagina or rectum and urinary tract there can be some abnormal connections, so mostly this is one of the congenital defect that you have to identify. And again palpate the genital area for presence of any nodes, mass and tumors, and also rectum you have to palpate for identifying if there is any fecal impaction. Okay, so mainly constipation there can be fecal impaction. And in the back and spine, that is you have to check for the deformities, so like kyphosis, kyphoscoliosis, lordosis, these are all some deformities where the thoracic and lumbar curvature of the spine will be deviated, so that you have to identify. And also in the pressure points like shoulders and the hips you have to see for any so on the vertebra you have to see if there is any ulceration, and also bruising of skin. And also check for the movement, so you have to tell the patient to bend and get up, so flexion, pull, and also ask the patient to walk, so we have to see whether the gait is steady. And also you have to tell the patient to stand, so that we can see if the patient is maintaining a proper posture. Apart from this, we must also do an anthropometric measurement. So here height and weight checking will be done, and BMI is body mass index, so that is done by weight in kg by height in meter square. So here you can see if the patient is underweight or overweight. And in infants you will be checking for the head circumference, abdominal circumference, so this all will see the nutritional status of the baby. And in toddler, that is 3 to 5 years, you will be checking for mid-arm circumference, this also to denote if the patient is nutritionally healthy. And finally we also do vital signs measurements, so these all dealt in classes detailedly. So in vital signs there is temperature, pulse, respiration, and BP is there, so these are the normal rates. So with this today's class is completed. I hope you would have understood my class. Thank you for listening. Please like, share, subscribe, and also click the notification button for